All right, welcome to the January 5th North Central Kansas Regional Report Out. We're here every Tuesday at 2:30 here through January. I encourage you, if you can't make the call, to sign up your email on covid.ks.gov/report-outs. That's with an S. That is covid.ks.gov/report-outs. You'll get an email as soon as this is wrapped up with a link to it, with a link to the dashboard. You can have that and share it with anybody you want. Also, if you have comments or questions you'd like us to discuss on the next one, please send us an email at ksregionalreport@gmail.com, ksregionalreport@gmail.com, and just let us know you're talking about the North Central region of Kansas. John Rolfe, I'm your chair of these calls, or your moderator, and we'll jump right into the dashboard here. So let me pull that up for everybody. Our friends at the Kansas Hospital Association so graciously put this together every week. Didn't quite get 100% of hospitals reporting. That's been common with some of the smaller hospitals around the holidays, had a little trouble getting it in. And then also something changed on the form over the new year on the federal form, where the default answer was no on the staffing shortages for the week. And sorry, my dog is drinking some water. I don't know if you guys can hear that. Apologize for the background noise. But the percentage of hospitals anticipating staffing shortage, that's zero. That's not accurate. The Hospital Association is going to help us get that, but that was a little glitch in the system. But the majority of hospital beds and information in the region is on here. And when sorry, my dog is tough on me right now. Okay, is the ICU bed availability. You'll see the 28 adult staffed ICU beds in the region, 9 available. That's 32%. That's as of yesterday. Obviously, a very dynamic and changing environment. And the 3 regions before, I think that number was trending in the wrong direction yesterday to today. I'll come down here also. We're still seeing one of the better curves in the state here for the. Am I on the right? It says Northwest region on here. I'm wondering, it says North Central here. I am wondering if this is, yep, this incomplete form. We'll get that fixed. So I don't have the North Central region. Actually, I can pull it up right here. What I was going to go to. Because we changed some of the reporting format, I didn't quite get right. So you can see all the regions here, but here's what's going on in the North Central region. We had a little dip, you can see everywhere, because the testing went down over the holidays, but stayed lower in North Central, only a 9% increase over the Christmas week comparatively to the other regions in the state there. So there's that data for you. Now let me go without a dog drinking a bowl of water in the background here. Let me kick it over to Carrie Ann to give us a public health update on what's going on in the region.
Hello, thank you. So a couple of things that are going on in our region.
And Carrie Ann, you're just a little soft. I don't know if you can get a little closer to your mic. I'm sorry to interrupt you.
Can you hear me now?
Yeah, can you introduce yourself and just where you're from? I need everybody to do that on the call.
Okay, yep, I'm Carrie Ann, the administrator for the health department in Ellsworth County. A couple big things that we've seen in our region over the past week is some outbreaks in a couple of our nursing home facilities. So they are being hit pretty hard, which obviously worries the hospitals for our areas, knowing that they will probably have to absorb some of that also. Other than that, we just continue to see the testing being done around the area. I think we saw a slight decrease in amount of testing that we've done. But I think our percent positivity is doing okay. I'm kind of nervous for this week and next week to see what numbers we see with the holidays just wrapping up and what effects we will see from all of those gatherings. So the other big thing that we keep getting questions on, I know at all of our health departments, is the vaccine, when we will get it, how we'll let people know. So that's the big thing we're trying to get the message out to people is we're not keeping secrets. We're not hiding anything from anybody. We know just as much as they do at this point. So that seems to be the hot topic. I think a lot of the media is causing a lot of those questions for us. So just trying to keep everybody informed with that. So just still encouraging people to get tested, stay home if they're sick, continue all that good education that I know everybody is tired of hearing. So, and luckily, like for our area in Ellsworth, the positivity at our correctional facility that had been a big effect on our numbers, we've seen a pretty good decrease in that. So hopefully that trend continues in our area for that.
Yeah, and speaking of positivity rate, Carrie Ann, the KDHE for last week for the area had it at 16.17% for North Central Kansas. That's the highest of the 7 regions, and 16.1% Northwest. That was the other close one to that, but 16.17. The state average was 13.8%. That's the week of 12/27 to January 2nd. And so, and then also on the vaccine, just speaking with KDHE this morning, I do believe it was a glitch. You know, Kansas is one of the first, or one of the only states that pushed the vaccine on its initial rollout to every county in the state. That's 105 in Kansas. And in that model, even some of the larger systems have had trouble with the software that the federal government's using to calculate the vaccine rollout numbers. So they didn't have any sitting in freezers or on shelves, not distributed. I know the state pushed it out and it's been getting used, but I think there's more information to come this week. Sounds like a website's being put together that we should be looking to hear more about, that can be a place of information for people on the vaccine. And I think the governor's going to roll out more information later this week too on the priority levels as the vaccine comes in. But on that call is on earlier today, what you said is true. Really limited information as far as when the next set will arrive from Pfizer, Moderna, or through any of the partnerships out there. You know, obviously in very high demand. So thank you, Carrie Ann, for that. Anything you'd want to add to wrap up? Okay, we appreciate you being here all the way from Ellsworth to Zoom. Now let me pass it over to Heather. Heather, can you give us any perspective from the hospital side of things?
Sure, you bet. Hi, I'm Heather Fuller. I'm with
and I'm going to ask you to get a little closer to your mic too, if you can. Thanks.
Yes. I'm Heather Fuller. I'm with the Sunflower Health Network in North Central Kansas. Just a couple quick points before I turn it over to our guest today. But when you look at that dashboard and you mentioned the ICU beds, and it shows that there are some availability there, one thing to note is that some of those might be ICU beds that aren't in Salina. So at the larger hospital, they might be at smaller ones. So they may not have the capabilities that some of these patients are needing. So just want to make sure that that picture is clear there. A lot of the hospitals have converted rooms into negative pressure rooms so that they have some more capacity for some of those folks, but that doesn't necessarily mean they have everything they need to take care of those patients. And as far as the vaccines you mentioned, a lot of the hospitals aren't getting that information quickly to be able to plan, and I'm sure the health departments are in the same boat too. So, you know, a lot of the folks around here, I think, had less than 24 hours notice before they got that first shipment. So that makes it a little difficult to try to plan and get everything set up to get, you know, they did very well, I think, getting those out the door and getting everybody vaccinated that they could. So just wanted to kind of give a heads up on that. And of course, staffing and staff morale continue to be a couple of the biggest issues that the hospitals in this area are dealing with, along with the vaccine information and trying to stay up to date on what's going on with that. But with that, I'd like to introduce Alan Van Driel, who's the CEO at Smith County Memorial Hospital, and he'll be able to give us a little bit better picture of what's going on out in the region. So, Alan.
Thanks, Heather. John, can you hear me?
Yes, sir.
Okay. Really, a lot of what I would have to say echoes what Carrie Ann and Heather have said already. We're seeing continued numbers of cases in the county. We've had a slight decrease in the number of hospitalized patients, but in the aftermath of the holiday, we are seeing an uptick, I believe, in the number of positive cases. I know we reported 5 positives here this morning, which is a pretty good number for us on an individual day. I also would echo what has already been said as far as the vaccine is concerned. We have received the first dose of the Pfizer vaccine for use for our staff. We had about 24 hours notice of when it was going to come. It got here along with the ancillary supplies, the syringes, and all of that we were supposed to get. We received a smaller shipment of Moderna vaccine late last week with about 4 hours notice that we were going to receive it. And when it came, we got just the vials of vaccine, nothing else. None of the syringes, none of the immunization cards, none of the other stuff that was supposed to come with it. And then last Thursday, I believe it was, we received an email from KHA relaying information from KDHE that we should expect to hear communication between Sunday and Tuesday about when we would get the second dose of the Pfizer vaccine, which we would be needing to administer this week. It's Tuesday afternoon, and we've heard nothing. We did get the ancillary supplies were shipped to us separately, and we did receive those yesterday, but we've not received any communication yet from KDHE about when we're going to get that second batch of Pfizer vaccine. So just the whole idea of keeping, number one, there are differences between the two vaccines. There are differences in how it has to be stored. There are differences in how it's administered. The Pfizer vaccine has 5 doses or 6 doses to a vial. The Moderna has 10. Once you draw the vaccine out of the Moderna vial, it has to be given within 6 hours. So that makes scheduling critical when we're trying to get staff immunized. I think most of the hospitals that I've talked to and most of the other facilities that I've talked to are seeing some reluctance on the part of some staff members. There's a tremendous amount of misinformation, I think, out there as far as side effects of the vaccine that's causing some reluctance on the part of some staff members to become immunized, which is very disappointing to us. We're starting a campaign of our own in the local community here using our physicians who've been very involved in our public facing process. We're going to use social media and some recorded messages and so forth to try to get the word out that when the vaccine does become available for the public, we want people to get vaccinated. We want them to not be afraid of the vaccine. Of course, at this point, as somebody already said, we have no idea when we're going to get vaccine that we're going to be able to administer to the public. And we're also getting, I think, probably what all of the health departments and probably most of the hospitals are getting. We're getting a lot of calls from the public saying, "Can I get on the list? When can I get my shot?" And we're still at the point where we have no idea when that vaccine is going to become available. So it's very difficult for us to say, "Sure, we'll put you on a list," but we don't know. How we don't know when we're going to be able to notify you that it's available. So communication is extremely difficult. I know that KDHE is doing what they can to try to communicate with the providers out here, but especially in the rural areas, it's challenging at best. So I think that's kind of what I would say at this point, unless anybody's got any questions.
That's great. Can you tell us a little bit about the facility that you're in?
So Smith County Memorial Hospital is a 16-bed critical access hospital. We moved into a new facility 2 years ago. So it's a fairly up-to-date facility, but most of these critical access hospitals out here, including ours, we don't plan on keeping patients that require a critical level of care. So we don't have an intensive care unit at all. When the pandemic first started, we sat down with our medical staff and talked about our plan for what would happen when we started seeing cases. And the plan at that point was, well, if we start seeing positive cases, we're going to stabilize them and ship them to someplace else. And that's turned out not to be reality, simply because there isn't bed capacity in other places. So we feel very fortunate. In Smith County, we have a very solid medical staff. We have 4 physicians, 4 family practice physicians. We have 4 mid-level practitioners, nurse practitioners, and physician assistants. The mid-levels do a combination of clinic practice and covering the ER as first call, and for that, we feel like we're in good shape as far as medical staff is concerned. And fortunately, we've got a medical staff that works very well together. So, it's not been difficult for us to put together a cohesive plan for what has happened, or for what our approach was going to be to the pandemic. But it certainly is a different plan that we're implementing than what we thought we would implement, because the reality is just very different.
Appreciate you bringing that up, and that's a good pivot for us to our friend Dr. Watson from Cheyenne Mountain Software, who's helping with a lot of the transfer issues, and I believe he has some real-time data he can share with us. Dr. Watson?
Yeah, great. With Cheyenne Mountain Software, and we monitor resources as well as assist hospitals with finding bed availability and transport, as well as providing them with data to help make critical decisions. But this is what we're looking at today. This is real time today, updated in the last couple hours, where we are seeing this capacity issue at a tertiary and quaternary care center level, and facilities that are really, especially in the ICU department, just really don't have much to offer right now. And I think when you look at the region itself, it is interesting because we're seeing 2 different populations form inside of the transfers that we have. A lot of these are less severe, even though the acuity index is 10. We're seeing that some of these are less severe and are just needing to move for some advanced care. But then we're seeing a whole nother group that's very significantly ill, that are needing complex care, and they're vying for the premium beds in the state, those that are ICU beds in hospitals that offer multiple specialties and the ability to do multi-organ support. And it is, the numbers are relatively the same. 40+% are COVID suspected, and about half of the people that come in contact with us through Mission Control are looking for a bed. So these numbers look remarkably similar. It's just you have these 2 different populations within that are making up what we're seeing now. We do have some capacity at a regional center, but and as a local level, we see more capacity, but we know that the real bottleneck here is the larger hospitals with the subspecialty care that can't be offered anywhere else. And so I think Heather was right on the money there of saying that you've got a facility that may have ICU beds. They're just not prepared to take care of the multi-system problems that some of these patients are developing. So we know there's more cases that are popping up after the holidays. If that'll translate into hospitalizations, we're waiting to see that, but certainly the next 2 weeks are going to be key and telling for what will happen next, I would think.
Yeah. And do you mind going back to that first screen just real quick too?
Yeah.
Yeah. So that red, when you look at this, this is live, I think, right?
Yeah.
So tier 1, it's just looking, if it's red, they're saying, hey, we don't have capacity in these. And so these are the bigger hospitals across the state, and just is painting a picture for what Alan's talking about running into, as far as if you have someone that's needing some real specialized care, it's taken a while to find them a room. Sometimes we were just hearing up to 8 hours in some cases, where you're trying to care for a patient before you can get them in the vehicle that's going to transfer them to where they need to go.
Exactly. Yep.
Alan, does this highlight what you were talking about, you think? Nope, you're muted.
Sorry. Yeah, it does. I mean, obviously the hospitals that he was highlighting there at the top of that chart are the ones in the eastern part of the state, which is not our normal referral patterns, but the story is the same pretty much everywhere. Because we're located up mid-state, up on the Kansas-Nebraska border, we tend to transfer a lot of people out of state actually for secondary and tertiary level care. But we send patients to Hays and Salina, as well as up into Nebraska. And the story is pretty much the same everywhere. It's bed capacity is at a premium, ICU bed capacity is at a premium. When we have patients that require, whether it's COVID or not, if we have a week ago, we had within a space of 12 hours, we had 2 myocardial infarctions that needed to go someplace that had a cath lab and had an ICU bed. And we had a real hard time finding bed space for them and finding transport capability. They both really needed to go by air, and there just simply weren't air resources available. So one of them ended up going by ground. The other one we did find a helicopter to take them.
Yeah, thank you for that. Well, before I wrap us up, is there anything anybody would want to add to the end of the call? Carrie Ann, Heather, Dr. Watson. All right. Well, I want to thank everybody for giving of your time every week for this report out. Again, this is the North Central region. We're here at 2:30 on this YouTube channel every Tuesday. We'll be here in the coming weeks. Again, you can sign up for the email that sends you a link to this conversation. And in that, I think you can watch it in faster time if you want to put us at like 1.5 speed or something like that. But go to covid.ks.gov/report-outs. That's covid.ks.gov/report-outs, and put in your email address, and we'll get you that dashboard in this. So I just want to thank everybody again for being a part of this. The next few weeks are critical. Really can tell that we're on the edge, and particularly in the larger metros where those acute patients need to go. So we'll be watching the numbers and here to report next week. And as we have information on vaccines that's data driven and helpful, we'll make sure that we include that in these calls. So appreciate everybody for their time, and Happy New Year.